Okay, I think we can go ahead and get started. Sue, what do you think?
Sure.
Okay, perfect. So thank you so much for Sue and the rest of the planning committee who invited us to speak at the DaCCoTA Symposium. We're super excited to be here. Keyonna and I will do our introductions here in a second, but we just wanted to give a little précis to our talk today. We'll be talking about initiating and sustaining partnerships. This is typically done between academic researchers and community partners. That's typically the audience that we present this talk to, but it can be applied to any sort of partnership, whether it's, a research setting in an academic institute, or between just community partners, or by the title of our talk, until health equity do us part. You may have heard this before, until death do us part. So even in your relationships at home, we like to think of research partnerships similar to a marriage. They kind of ebb and flow, and there can be challenges along the way. So today's talk, we're going to talk about how you initiate and sustain those partnerships to have the best outcome, and provide some of the best practices and fundamentals for a successful partnership. So Sue, I'll have you advance to the next slide.
Sure. There we go. And again?
Nope, this is perfect. So
back.
Yep, go back one. So we are part of the Great Plains IDEA CTR. So similar to the DaCCoTA CTR, our CTR is from Nebraska. We are headquartered at the University of Nebraska Medical Center, and our partner sites span the state. So all of the University of Nebraska sites, including University of Omaha, Lincoln, and Kearney. We also have partners with Creighton University, the VA, Boys Town, and Children's Hospital. So our CTR spans Nebraska, and Keyonna and I are part of the Community Engagement and Outreach Core, and I'll go ahead and let Keyonna introduce herself.
Awesome, thank you, Emily. As Emily said, I am the director of the Community Engagement Outreach Core. I'm also an associate professor in the Department of Health Promotions, and I lead a team in the Center for Reducing Health Disparities, where we focus on the North Omaha catchment area. So our university is located in Omaha, Nebraska, and on the north side of town is where our center focuses our efforts in helping to eliminate health disparities by working with community. My background is in community engagement. In particular, I'm an expert. I have an expertise in community-based participatory research as an approach to engaging communities in research, specifically in a way that they identify and prioritize what that health priority is that we are addressing, but also helping to build their capacity to conduct research in their own right, as well as trying to make sure that they are identifying those issues that we have in terms of health equity and, of course, disparities.
And I am Emily Frankel. I am Keyonna's co-director for the Community Engagement Outreach Core, and I also manage our practice-based research network. So much like the ACORN network at the DaCCoTAs, we have a Great Plains Primary Care practice-based research network, and so I lead those efforts. And with that, Sue, we will get right into the meats of this talk.
All right, before we begin, I always want to thank and give shout outs to really important people, not only in my career, but as a part of helping to put this presentation together. So these are a list of some of my mentors, both in community as well as in academic institutions. So I want to give a shout out to all of them. And in particular, I want to give a shout out to Dr. Julie Smith-Linemy. Because of her relationship with us, we are able to present with you all today. And of course, we cannot forget our funders and supporters, the National Institute of General Medical Sciences, NINGMS, for the funds that are used through our IDEA CTR to support our core and to help us to be here today to talk with you all. Next slide, Ms. Sue. Thank you.
All right, so typically if this talk were in person, at this time we would do a little activity. We're going to try our best to do it virtually. It'll be a little bit different than how we would do it in person, but I'll go ahead and explain the activity and then we'll do it here as a group in the most virtual way possible. So this is the Web of Yarn activity. Typically what we would do is stand in a circle and have one ball of yarn. We would take turns throwing the yarn to someone not directly next to us. And when you get the piece of yarn or the ball of yarn, you would say why you decided to attend this talk today. And then after you completed this question, you would throw it to someone else, again, not someone standing next to you. And over time, we would build this yarn web. And then there's a little takeaway after that. So what we thought we would do is if everyone could unmute themselves and we can call on you one by one, or you can volunteer and just briefly say why you decided to attend this talk today. We would love to hear from you and make this as interactive as possible.
Well, I will just say that a couple of reasons I'm here today. One is that I was assigned to be host of this presentation as a DaCCoTA staff member, but even if I wasn't, this is one that I would definitely choose to attend, because I feel that community engagement and working with communities is such an important piece of research and what we do. And there's always more that one I can be learning. Communities are always evolving and always changing, and there's never I'm never learned ed. I'm always learning, and so that is part of why I chose to be here today.
Great, thank you, Sue. Holly, you were the next one.